question that always comes up in homeopathic practice, especially for students, young practitioners, and those who don't consider miasms, is everyone gets results. So, what is the need to study miasms if we prescribe on similia similibus curantur? So, if homeopathy is based on the principle of similia similibus curantur, then why do we need to study miasms? We can get results without taking consideration of miasms. We can prescribe on the totality of symptoms. Even Herring had this question to Dr. Honeyman, that what is the need for miasms if we prescribe the most similar medicine. Now this question had come up with Dr. Honeyman also, and Honeyman has said this categorically in chronic diseases, that theory of chronic disease is even more important than the similia similibus curantur, because after taking totality of symptoms, in many cases Honeyman realized that with this medicine given, which is apparently very similar, we get results but do not get cures. The patient is better for some time, but after that the case slips. Why do these cases slip? Is because of our lack of understanding of miasms. As Allen has written in Chronic Miasms, he has given an answer to this question where he says that we can win a war only if we know the enemy completely. And to know the enemy completely, that is in our case the disease completely, it is very important to know the soil in which this patient has grown, the disease has grown, mentally and physically. So unless we take miasms into consideration, we cannot cure majority of the chronic diseases. All our patients will only be better, but never get cured unless miasm is taken into consideration. So to know whether we need to study miasms or no, the simple test is go back through your case records in our clinic and find out in how many cases we have been able to cure a chronic disease completely and not just keep the patient better. Find out how many cases we have been able to cure completely and tell the patient that we have cured you and we have come to the end of the treatment. If we have been able to do it, then great. If we have not been able to do it, then definitely we need to study miasms.